one of the ways that I try to teach or work with people around meditative interventions around addiction has to do with sort of the cross section or the intersection between teachings that originate with historical Buddha, teachings that originate with a psychiatrist from France named Pierre Janet, and who was a contemporary of Freud, and then modern trauma and addiction specialists who have either folded mindfulness practice into what they're doing, or mindfulness practice is at the center of what they're doing, and other wisdom is brought into it. And so when a person is working on their substance or behavioral addiction, and mindfulness is part of the picture, we can go back to the earlier teachings that say suffering, right? That we are either in a state of, call it suffering, or unsatisfactoriness. And the second teaching that goes with that is that there's a cause of all that, and it's not the pain of life per se. It's our craving, our clinging, our attachment to getting rid of that which we don't like and bringing in as much of the pleasure as we can. So by definition, in a sense, and many people have spoken about this, there is a relationship between that teaching of suffering and unsatisfactoriness and addiction. Addiction is the craving and the clinging, the attachment taken next level. It's taken to the point of, sometimes I like to say, addicted people do it better, right? We crave and we cling better than the average bear. And so what can we do with that knowledge? Well, we can add to it the knowledge that suffering and unsatisfactoriness also can be described as trauma and adverse life events. And our thinking with the older teachings, again, mixes in with that. It's like, trauma and adverse life events. That sounds a little bit like suffering and unsatisfactoriness, right? So Pierre Janet said that there are 3 stages to treating the trauma and the adverse life events, and that is stabilization and preparation. And then there is, some people use the word liquidation, or the transformation of the suffering, of the traumatic material. And then the third is essentially can be described as relapse prevention, as working on future fears related to what happened in the past, and then just living a fabulous life.